One of the most common muscles we'll see that do spasm in that low back is a muscle we call your quadratus lumborum. So the QL muscle is a muscle that sits at the bottom aspect of your lower ribs here and travels to the top aspect of your pelvis. So that muscle essentially helps control not only lumbar rotation of that low back, but also stabilization of that low back. And so that muscle can bite down and become a little bit tighter. And the symptoms of that are typically going to be unilateral or one-sided back pain that's located just on top of that pelvis. And we may even notice some of this pain that's associated with respiratory patterns. So when we're breathing in or out, it can cause that muscle to tighten. So one of our favorite movements to stretch that particular muscle, if that's what we have going on, is going to be an exercise we call a supine, so face up, torso rotation, while focusing on that diaphragmatic and abdominal brace here. So I'm going to show you that exercise right here. So we're going to start off in this face-up position. So we're going to have our hips at 90, knees at 90, feet firmly on the ground. The first movement we're going to want to do through this entire movement is going to be focusing on a diaphragmatic brace. So I like to achieve this by some nasal breathing. So we breathe in through the nose, maybe about half a breath, and focus on filling up this abdominal canister right here. So we want to keep this area nice and braced. Now throughout the movement, we don't necessarily want to hold our breath, but we do want to maintain some consistent pressure through the movement. So while I hold that abdominal brace here, I'm going to take my knees and I'm just going to rotate them as far as we can to the left, as far as we can to the right. Left, right, left, right. Now, while we're holding this movement, again, focusing on maintaining that abdominal pressure, we may also turn our head the opposite direction of our knees here to achieve a little bit deeper of a stretch here. Now, I do want to differentiate this movement from a very common exercise we'll have patients do that are maybe a hyper-rotation or a piriformis related stretch where we might draw our knees up and just rotate as far as we can over here. Now, while this is a good stretch and pull through that low back, I prefer the diaphragmatic brace while we do this exercise because it helps stabilize that low back versus these movements without a diaphragmatic brace. I am going to create hyper-rotation of that lumbar spine, which can sometimes precipitate some injuries here. So during that movement, we'll just want to focus on going as far as the tissue will allow us, and we'll gradually increase that range of motion here. Now this exercise is one of our favorite movements to help stretch out those low back muscles that we can oftentimes get from different things around the house, such as shoveling or during these cooler months, or sometimes just sitting a little too much at our desk. Now if you're feeling a little extra stiffness, don't hesitate to reach out to us. Chiropractic adjustments coupled with very focused stretching activities for those tight segments of our spine can be very helpful at restoring normal spinal movement and muscle tone. If you're dealing with a little bit more persistent tightness or pain, don't hesitate again to reach out to us and schedule appointments so we can get that taken care of for you. Now, if you like the content that we've been providing here, feel free to like this video. You can share it with your friends, or if you have a direction of stuff that you'd like us to work on here, maybe some different conditions that you're battling, feel free to share that in the comments here, and we can try to get some videos for that might be able to help you out. Thanks. Until next time, we're here at Life in Motion Chiropractic.